Hello guys, I welcome all of you to today's Pharmcast, and today again we'll be discussing about 5 different disorders, 5 different drugs of choice. And for a change guys, I will today discuss one of my quotes, and that is to give you some inspiration, right? So let's begin guys straight away. The first disorder is toxicity of a drug, and that is atropine. So atropine toxicity guys, what is the drug of choice? Think. It's an easy one. It has been asked many times in your exam. And such questions guys, you should take at least, not more than 2 to 3 seconds to answer. So atropine toxicity guys, drug of choice is physostigmine. Now sometimes I get a doubt from students, sir, why not neostigmine, right? Why physostigmine? Because remember guys, atropine is a tertiary amine. It crosses blood-brain barrier, and for that I need a tertiary amine like physostigmine which crosses blood-brain barrier, and you know that neostigmine is a quaternary amine which does not cross blood-brain barrier, and that is why we cannot use it, right? Apart from that guys, physostigmine, it is also drug of choice for datura poisoning. Datura, that fruit, you know, that green color fruit, which is thorny fruit, that has atropine like compounds, for which physostigmine. So physostigmine is the drug of choice for atropine toxicity, datura poisoning, as well as belladonna poisoning, right? Three conditions. Moving on to the second disorder guys today, atypical pneumonia. Guys, think, what is the drug of choice for atypical pneumonia? Atypical pneumonia, as you know, can be caused by chlamydia, mycoplasma, or legionella. So what do you think guys? See, remember, atypical pneumonia guys, the best drugs are macrolides, and the current macrolide of choice is azithromycin, because it is much longer acting, plus it has lesser drug interactions, because azithromycin is not as potent an enzyme inhibitor as compared to erythromycin. But remember one more thing guys, chlamydia and mycoplasma, if they cause pneumonia that is atypical, I go for azithromycin. But if chlamydia and mycoplasma they cause UTI, urinary tract infection, then I go for doxycycline. Now guys, moving on to the third disorder for today, it is autoimmune hemolytic anemia. Remember guys, it is autoimmune. So what should we use here? Think. See, I do not use one single drug. We use here a combination of 2 drugs. So what is the combination of 2 drugs we use here for treatment of autoimmune hemolytic anemia? Obviously guys, we have to suppress the immune system. So we use steroids. So prednisolone plus rituximab. Rituximab. Which class of drug does it belong to? Rituximab. It has been asked in our exams. Guys, rituximab is anti-CD20 monoclonal antibodies. So by giving prednisolone, we will suppress production of your immune cells. CD20 antibody, rituximab, will directly target your immune cells, and that is why we are using a combination of prednisolone and rituximab as treatment of choice in autoimmune hemolytic anemia. Moving on guys to the fourth disorder for today, babesiosis. So guys, babesiosis can be classified as mild, moderate, severe, and there is some controversy. In fact, I would say that there is an update. Guys, as of now, what you need to remember, whatever may be the severity, mild, moderate or severe, for babesiosis, the current treatment of choice is atovaquone plus azithromycin. Right? So what is the controversy? Previously, for severe cases, the treatment of choice used to be clindamycin plus quinine. Now it has been changed recently, and for all stages, mild, moderate or severe, the treatment of choice is atovaquone plus azithromycin. Now guys, coming to the last disorder for today, and that is bacterial vaginosis. So guys, bacterial vaginosis, the drug of choice is, think guys, what is the drug of choice? Bacterial vaginosis. The drug of choice is metronidazole. Now guys, metronidazole is a very important drug. It's a very important drug. So think for a while, for what else metronidazole is drug of choice? Think for a while, for a few seconds, what comes into your mind? See guys, metronidazole is drug of choice for amoebiasis, extraintestinal. It is drug of choice for giardiasis. It is drug of choice for bacterial vaginosis. It is drug of choice for trichomoniasis. So you can see these 4 conditions which I told you, these are the most commonly asked, right, where metro is the drug of choice. So guys, these are the 5 conditions which we had to discuss today, for which we had different drugs as drug of choice. And finally guys, we have come to the last part of our Pharmcast, And where I say today I'll be discussing a quote, right? I'll not discuss a concern because we've discussed already a lot of concerns in the previous Pharmcast. And this quote is for those students who think that they are inferior to some other students and they cannot score a good rank in the exam. Right? For those students, what I'm gonna read now is my quote. That is, hard work can compensate for intelligence, but intelligence can never ever compensate for hard work. So guys, what does it mean? It means that the most important ingredient, right, in the recipe for getting a good rank in any competitive exams is hard work, right? So you cannot make this curry of competitive exam without adequate hard work. That is most important ingredient. So even if you think that you are less intelligent from someone else and that is why you are out of the race, think again guys, you are not yet out of the race, because by increasing the horizon of your hard work, you can compensate for anything, right? You can compensate for anything and you can beat the bestest of the best person in the room that we have, and you can get your desired branch or seat of choice. So guys, that's all for today. Take care. Bye-bye. This was Dr. Ranjan.